right. Now, so this is the website. You need to go through it, have a read about it, just have a look quickly. Okay. Now, what else you need to read? Can you see this? We call it medical emergency guidelines. If you don't have the file, I can send it, but definitely you can find it. It is Walsall practice guidelines. This will give you a brief description, okay, about how you manage the cases. Just a brief, okay. So this is talk about the adrenaline, aspirin, glucagon, glucose. This is the medication in the medical emergency dental practice, and how we can repeat them, how many times, what is the dose. It is really nice and good. And here, this is the different medical emergency. This is a brief. This is what you need to follow. If there is any information contradict with your readings, with your study materials, you need to follow this. This is the guidelines, okay? So this cover adrenal crisis, anaphylaxis, asthma, cardiac emergency, epileptic seizure, hypoglycemia, stroke, and syncope. This is what you need to follow. Very important. Really nice and good. This is what we used to study. This is the handout for management of medical emergency in dental practice. This is...
Hi, doctor.
Yes, dear.
Can you show me the before slide?
Yes.
Yeah.
Okay. Okay. Everything will be recorded and I will be posted in YouTube. So I will be more than appreciate if you cannot interrupt me, please. So everything will be in the YouTube again, so you can see everything later. Okay. Anyone who don't have this file can Google, or I can send it. I can share it in the group definitely. Okay. Really appreciate it. Thank you very much. So now this is research guidelines. This is superseded November 2013. It is not work anymore, but our reference is the BNF, but nothing changed. So you still can read through this one. This will tell you about the steps and about everything, okay? And if you're looking for updates, you need to check the BNF medical emergency chapter. Now, why medical emergency? Why it's important? Medical emergency dental practice that have been reported syncope. Syncope is the most common medical emergency, about 63%. Angina 12 and the others as well. So that's why the syncope is the most common medical emergency in the dental practice. Always remember that, please. Especially part 2 candidates. This is very important. Guidelines. What is the guidelines? Now, every single part in your exams, you are applying or you are showing that you are following the General Dental Council standards. This is this book. This is why you have exam. They want to know that you are following the standards. In the courses that we do, answering cases, OSCEs, medical emergency, we ensure that you understand. It is of a big issue now. You need to be aware about medical emergency. Okay, thank you. Okay, so it is very important. And now the material is more linked, the exam is more linked and highly adhered to this standard. So it is a good idea to be aware of them. Now, what is the principles? We have General Dental Council's regulations. We can't work only when this being applied in the practice, because you are responsible as well. Okay, if there is any problem with this, I will not work at that day, for example. You don't want to work in anything that's not following the JDC regulation, otherwise you'll be in a big trouble. So always the regulation said that there should be always arrangement for at least 2 people available in deal with medical emergency. So if there is anything happen, should be at least 2 in the room. There is a plan. There should be a plan. and definitely it will be the dentist and the nurse. All the members should be registered with a medical emergency. Even the receptions, anybody there, they should know how to deal, or at least with the basic life support. All members of staff who might be involved in dealing with medical emergency are trained and prepared to deal with such emergency. Listen, basic life support, medical emergency, not the medical side, but basic life support is attached to every single moment in our life. It is something you might need to deal with a family member, with a friend in the street outside. So you need to get ready, and you need to, it is a good idea to be aware how you do it. All new members of staff should have resuscitation training as part of their induction program. JDC put 10 hours mandatory, or if you start practicing in any dental practice, there will be induction course. They will make sure it is a requirement to be registered. Dental care professional must ensure that they are able to deal with any medical emergency that may arise in the dental practice. It is very important to be aware how to deal. That's why we give these courses. That's why you will be, one second, there will be a limit for, they will test your ability to deal with such medical emergency. Always, I tell my students, always, this exam is designed to keep you safe when you will be a real dentist. Now, the recognition that medical emergency cardiac arrest situation may be preventable had led to development of courses just, specifically designed to prevent occurrence. That's why they put 10 hours per cycle. That's why, because when we have medical emergency, we are just trying to buy time, to add time, to use that time until the ambulance will come and the help will come. So it is a good idea to be a proper trained to manage the situation, because it's a matter of saving people's life in a matter of minutes. All dental practice should have a process for medical risk assessment of their patients. All risk assessment policies are submitted, applied in every single life. If I am working and I just notice that there is a cable, there is a wire, or there is anything wrong, there is a sharp edge on the hands, I need to inform practice manager. It is your duty, it is your responsibility as well. Medical and drug history, very important. All the plan should be, all the staff should be aware of that, the using of the drugs, the medication, how they secure it, and how where it will be locked. Dental practice should have a plan in place for summoning medical assistance in an emergency. Ambulance should be summoned at the earliest. Each practice, if you see in the wall that there is a procedure we need to follow, because in the medical emergency, in a rush, people will get confused. So there should be always, for example, if you are a dentist, you just start working, next day you have medical emergency, you don't know the number, so at least there is a plan, a procedure on the wall, so you can check the numbers, which hospital you call, what you need to do always. This is summary for all what we talked about. Calling 999. This protocol should be a brief description of the event. Good morning, my name is Mohammed, one of dentists here. I am working in my dentist dental practice. I have a gentleman here. He looks like he have angina attack at the moment. My address is 1 Park Avenue, M19 to GY. Please, can you come as soon as you, as quick as you can? My mobile number is 07907266610. Is it clear? Can you confirm it, please, for me? This is the protocol. It is very important to show that you are confirming the information, especially in your exam, please. Okay. Now, I like this page. I really like this page, because this page is specify which standards in the JDC standards booklets here. So if there is any argument or anything or any scenario, any possible scenario, you are aware which one it is, okay? So JDC standard is 1.5, you must treat patient in a hygienic and safe environment. This is related to the medical emergency. JDC standard 6.2, you must be appropriately support when treating the patient. Medical emergency happen at any time, you must make sure that there is at least one other person available. This is the guidelines. JDC standards 666, all medical emergencies happen time, but you must make sure that the arrangement of at least 2 people, all the same, but this is the classification of the standard again. This is just again as a summary, but mentioning exactly which standards is applied here. Now, medical history, such a vital part. It is a life-saving for the patient, and it is a life-saving for you as a dentist. You need to make sure that you take a proper medical history. You need to make sure that you take a proper history for social history as well, to know if the patient smoker, drinker. Okay. As for you, part 1 candidates, it is very important the way or the style you study. It is very important, especially for LDS Part 1. If you want to pass this exam, you need to kill the scholar. You need to study scholar well. What you will do, I suggest you to use this time. Do summaries for the chapter, for the important chapters, and how you think, okay, I am a dentist. I am sitting on my practice. The patient opens the door and comes to me. Think about the general signs that you might think it is like having pain on the back, having pain on the joints, any patch, any hand crippling, any fingers. What is the sign? Okay, the patient is sit now in the chair. If I see something in the patient mouth, what I expect, what is the symptoms, how I link it to the different conditions, and again now, what is the management, what is the blood tests need, what is the investigations required. Okay, this is how you need to think about reading the Scully, or again the medical history. All should be, and we follow the acronym always: A, B, C, D, E, F, G, H, I, J, K. This is what I do in the course. It's really nice and easier. A, allergy; B, breathing, bleeding; C, circulation, cardiac; D, diabetes and other drugs, and etc. Okay. Now, for part 2, you might encounter with Oscar for blood pressure. I shared this video. This is very nice and beautiful, and this is all what you need to do in Oscar. I will leave it with this beautiful video for a second, for a minute.
Hi, my name's Simon. I'm one of the final year medical students. Can I just check your name and age, please?
Yeah, my name's Andrew and I'm 25.
Nice to meet you, Andrew. Today I'd like to take your blood pressure, so that will entail me taking this cuff, inflating it around your arm, feeling and listening to your pulse. Does that sound okay?
Yeah, that's fine.
It might be a little bit uncomfortable, but it shouldn't hurt.
That's all right.
Are you okay for me to go ahead?
Yeah.
Lovely. If you just pop your arm on the table, that's lovely. Fine.
Yeah, and the instructions will help you do the actual test.
Yeah, thank you.
I can't understand how people can do this. Anyway.
And I'm just going to feel your pulse now. That completes the procedure. Thank you very much, Andrew.
Thank you.
So, can you just confirm for me, can you hear me, please?
Yes.
Good,
Okay.
brilliant. So this is the procedure how we check the blood
Yes, sir.
pressure. Even in the OSCE, you do exactly, but at the end of, do not shake hands, please. Okay. Now, the drugs, you need to know these drugs just like your names, the doses, GTN, glycerol trinitrate, 400 micrograms, salbutamol, 100 micrograms. This is the GTN. This is just a dummy one. Okay. This is the spray. We have two. I think we have another one. Yes, we have two colors as well. This one as well. Salbutamol inhaler. I think you are aware of it. This is the salbutamol inhaler. Okay. This is the blue and the blue one we call it. Okay. Adrenal injectants come in ampoule like this one. Okay, packet of an ampoule, or we have as injector. This is a dummy of the self-injector. Okay, so always remember this is how it will work, and we call it blue to the sky. You remove and then inject. This is how it works. We have two different, one which is the self-injector. This is a 330 micrograms, so that couldn't be in the medical emergency books. The one in the medical emergency books, if it is like this, it should be of 500 microgram. Adrenaline, aspirin, 300 milligram chewable dispersal. Okay, like this one, just chewable tablets. Okay, glucagon, it comes in this packet as well, the orange one. Glucose solutions, any solutions, anything that increase the sugar or the glucose level, or like this glucogel, for example. Midazolam, this is a dummy one. It comes in like this, and this is where you inject inside the patient's mouth. Drugs where possible should be pre-filled. This is been used since the last few years. IV is discouraged. All medication should be stored in easily accessed a place, and all the stuff. Usually it will be easily accessed, and it will be a big bag and just in front of you. So the responsible person will be checked all the medication weekly, check the expiration, and make sure everything is filled and ready to use. All clinical areas should have immediate access to the resuscitation drugs, equipment for airways management, and automated defibrillation. Now the AED defibrillation. There is a different type and shape. This is a small one, nice and beautiful one, okay? And this is the pad where you can put it on the patient chest, okay? It will give you the instruction where to put it, how to put it, where to start, okay? And you can just simply switch it on like this, and you follow the instructions.
Applying pads to patient's bare chest. Plug in pads connector next to flashing light. Applying pads. Plug in connector. Applying pads. Plug in connector.
After you connect it, he will give you orders about the shock, when to start, when to repeat, and he will tell you when to end.
Applying pads. Insert connector firmly.
Okay.
Applying pads to patient's bare chest. Plug in. Applying pads.
Now,
Plug in connector.
so why it is important? Because the defibrillation is showing that saving life of people. It is very important, and now they are tend to put defibrillation everywhere in Asda, Sainsbury, or anywhere. This one, no, minimum equipment recommended: portable oxygen cylinder, D size, oxygen face mask, or a pharyngeal airways tube. It comes in different size and in different colors. Okay. Pocket mask. This is the pocket mask. Okay, where you will have a seal on it. Okay, there is a seal on it. This is how they put it here. So we'll make sure use like this. This is how we hold it. Okay, this is a pocket mask. This is a must. Self-inflating bag. This is where you hold it in two hands. Adult and child face mask for attaching self-inflating bag. The same. Portable suctions. This is the anchor solution. This is the tip of it, and there is a portable holder. Single-use straws, needles, and a spacer for inhale. This is spacer. It comes in different size and shape. This is dismantle. I need to know how to assemble it and how to use it. Where possible, all emergency medical equipment should be single-use and latex-free. Maybe you see this boring, but this is important. This comes in any part of the exam. You need to know this in details, please. Always there should be a person designated, and there is a replacement person to make sure everything following the guidelines and everything is being put in place. All staff should be familiar with the use of the mode of operation. Patient chance of survival reduced by 7-10% each minute is defibrillation doesn't occur. That's why they are encouraging to have defibrillation effort. Clinical audit. This is very important. Always make sure the staff is meeting together, especially if there is an incident of medical emergency. It is the time that we said it's the time for a coffee. We sit together, we discuss what happened, what is the downside in our management, what is the problem, if we have any downside or any negative side of our procedures. We will discuss it, we will add, we will share opinions, ideas. This is very, very important. Okay, now, initial assessment, airway, breathing, circulation, disability, exposure, approach. This is the approach we use in UK. You need to know every single details about it. Every single details is important about this approach, please. Okay. In your exam, in part 2, this is the approach you use. Never say A, B, C. Okay, you need to say airway, breathing, circulation, disability, exposure, approach. How we assess? We assess one by one. And when you assess the patient or any medical emergency, you need to assess airway. If you sort out the problem, you managed it, then you move to the breathing, then you move to the circulation. Okay, if you couldn't manage airway, so you can't go to a breathing. Before, the assessment used to be called ABC. Now they added D and E. However, D and E is still, if you manage ABC, the disabled and exposure will be almost managed. So still ABC is the most important part. For airway, please listen to me. The way you need to explain, the way you need to know is very important, especially in OSKs, guys. Okay. For airway, you need to look for signs of any airway obstructions. You need to check if there is a complete obstruction, full obstruction. So we're looking for complete obstructions and for partial obstruction. For complete obstruction, you'll see that the patient has paradoxical chest on abdominal movement, or what we call it a seesaw movement. Sometimes the patient, when they have obstruction, they use the accessory muscles of the neck and of the abdomen as well. Signs for complete obstructions is central cyanosis, discoloration of the lip, of the tongue, and the hands as well. How we assess the partial obstruction? If there is a partial obstructions, we need to know for sounds. You need to know it by name, please. Stridor, where the obstruction will be at the laryngeal level. Expiratory wheeze, when we have asthma, which is in the lower airways tract, gurgling, and this where we're expecting that there is a fluid or a foreign body that occluding the airway canal. Snoring, when at this point where the pharynx is occluded, so the obstruction will be in the level of the pharynx. This is, you need to know that, please. This is very important. Breathing. For a breathing, and by the way, for the airway, the way you check, you look for any, you check the patient mouth, you look for any foreign body, any fluid, anything that's blocking the airway. Nothing, everything is fine, then you will move. And this is the gentleman here, okay? This is your, so when we assess always, we assess by the way of look and listen and feel. I will move to the CPR and BLS later, but just to let you know, we always do head tilt, chin lift, okay, and check if there is any problem with the airway. And the first assessment is look, listen, and feel. So you look to the chest, you listen to the noise of the mouth, and you feel if the patient is breathing or not. After that, we will discuss how we assess the CPR and the basic life support. So for a breathing, it's very important to check the respiratory rate, and we see if the patient can breathe normal or not. We need to check and assess the chest movement, the movement of the chest, if they are coincide together, if there is any problem with the chest, if the patient using accessory muscles again, if the patient using the abdominal or seesaw movement again. Again, you need to count the respiratory rate. We need to know that it is 12 to 20 in adult and 20 to 30 in children. Assess the depth of the respiration. That piece is very important as well. No problem with the breathing. We will move to circulation. Oh, it is very important and vital part of the medical emergency management, or IBC. With the circulation, we will check the color of the patient hands, of the patient lips. We will check the temperature of the patients. We need to check the capillary refill of the patient, which is where we press here, and it will be the normal recapillary is 2 seconds. Check the blood pressure. Check the central pulse rate on the hands or on the neck. Disability, it is the patient to be unable to move, and it could be for many reasons. That's why sometimes we need to assess the patient medical history if it is available. We need to check the dilated pupils. We need to check the pattern of AVP, A alert, V respond to verbal, and P to the painful stimuli, and U is unresponsive. Last, exposure. We need to check, assess if there is any bruises, any rash, any problems, and always remember that I need to respect the patient dignity. This is very important. So this is the initial assessment. This is the protocol that we follow, or the approach: airway, breathing, circulation, disability, exposure approach. Generally speaking, for any medical emergency, stop the procedure, stay calm, ensure safety. So this is everywhere, not in the dental practice. This is maybe in the road, in the house. So if you see that the patient is unconscious, okay, leave everything, check the patient. If you are on the street, ensure that you are safe and the patient is or the victim is safe as well. We don't want you to be a victim as well. Okay, so assess the danger always around you and shout for help. Just shout. Then you will come to the victim and you check for 10 seconds, look, listen, and feel. If you see that there is no breathing, call 999 and start the CPR. Again, assess the danger, shout for help, look, listen, feel for 10 seconds, no breathing, call ambulance, then start CPR. When you are going to start the CPR, when you will be exhausted, when there's somebody, the help is arrive, or the patient regain consciousness. Generally speaking, after any medical emergency, record the medical emergencies. It is important to record it in the incidental logbook. First aid treatment, tell the patient what happened, explain what happened. If he is diabetic, maybe he can't go home, escort him, take taxi to him, speak to the family member, make sure he is safe, or refer to the hospital, change the patient to the hospital, what happened to the patient, and all check with the patient GP. If the patient have hypoglycemia, for example, call the GP. I think he needs adjusted for the insulin dose. All the medication used should be replenished and refilled again. Review, auditing, discussing what happened, what will happen, and write everything in details in the incidental logbook. Now, medical emergency signs and symptoms. We'll come to the game. Medical emergency today. We will. Okay, we have good time. Great. We'll discuss asthma, angina, anaphylaxis, and all these. And today, I am adding important subjects which nobody talk about it. It is highlighted now by NHS. It is very concerned about it, and they emphasize on it. So be careful about it, please. Okay. Which is sepsis. We need to talk about sepsis today. Now, your patient this morning, Mr. Adam Werner, is a 57 years old male. He was seen last week for an initial examination. He has not received dental treatment in the past 7 years. When you read this, in the past 7 years, so definitely that the patient is scared from a dentist. Any patient that he didn't attend for 2 years, you will see that he is sad. When you say hi to him, he will not smile and he barely answer you. So he is stressed, he is scared from the dentist. The patient reluctantly agreed to his treatment. You can't believe how many patients I see. They came to the room, I said, please just cancel it today. Just give me another chance. Okay? It's 5 minutes late for his 10 a.m. appointment. As you approached him with an injection, he has become quite pale, number one, and hair on his arm is standing. He is beginning to sweat profusely, frequently yawns. You ask him if he is feeling well, and he states that he is fine, just a little nervous and a bit dizzy. You pick the syringe and notice that he has lost consciousness. He's gone. Relax. Do not worry about that. Okay? Faint is the most common cause of sudden loss of consciousness, as we said before. Heart rate of dilatation of the blood vessel. This is very simple. Very simple. Dilatation of the blood vessels to the brain, pooling of the blood, so there is less blood, less nutrition, less food, less oxygen to the brain. So this will lead to the patient lose its consciousness, their consciousness. Causes, what do you think? Anxiety, pain, fasting, temperature, sudden rise from lying. Every 10 patients, I have 2 patients. If I sudden raises the patient, they will lose consciousness. Especially for people, because with eldest people, with the list of medication, with polypharmacy, you need to be careful about that. So always inform them, make it very gradually, 1, 2, 3. So you need to be careful about this point. But definitely, the anxious patients or the pain, it is the main causes. Sometimes stress, sometimes social problems also add a cause to them. Now, signs and symptoms. Signs and symptoms. Patient felt dizzy, slow pulse rates, low blood pressure, definitely, pale, sweating, nausea, vomiting, loss, which will end with loss of conscious. Okay, so very important to remember: dizzy, slow pulse rate, low blood pressure, pale, sweating, nausea, vomiting. This is common signs and symptoms. Management. Assess according to airway, part 2 people, part 1 people, mainly part 2 people. Assess the patient according to airway, breathing, circulation, support, exposure approach. It seems to me that the patient have syncope. Nurse, please bring me the emergency box, shout for help. Then what we will do, lie the patient flat just to restore the blood pressure. Lie the patient flat, give the patient oxygen. If any tight cloth, just loosen it, elevate legs, and very important to check a blood glucose meanwhile, because it could be mixed with hypoglycemia. Reassure the patient, monitor. If everything is fine, reassure the patient and record what happened. So again, simple and easy. And 99% of the patient with syncope, they will restore and will regain consciousness in a few minutes after that. Just follow ABCD, airway, breathing, circulation, stability approach. Shout for help, lie the patient flat, raise legs, okay, keep reassurance, give oxygen. And always, at the end of any medical emergency, record everything in the patient file, patient records, report to any family member, report to patient, GP patients, and replace anything you need. On regaining conscious, raise chair slowly, give a glucose drink or an aperitif of operator. So 1 second. Okay. Just let me answer. There is somebody here. Yes. Now, choking. Your patient, Mr. Smith Adam, is 65 years old, male. You are attempting to re-cement a temporary crown that came off over the weekend. The crown slips out of your wet gloves and has entered your patient's throat. He places her hands to her neck, is aggressively coughing and having difficulty breathing. What should you do? It is really common, and it will happen. It happened with me 2 times. Luckily, the patient didn't swallow anything. He just coughed it. He just coughed it and spit it out. Now, dental patients are susceptible to choking with the potential risk of aspiration. Now, I want to share this video. If you can listen to it, so just continue. If you can't, just inform me, please.
If your baby's choking, you may notice that they're unable to cry or breathe. So what we're going to do is, first of all, have a little look in the mouth. As we take a little look in the mouth, if there's anything that we can see that we can pick out, we might try to do that. What we're not going to do, however, is start sticking our fingers in there, because the object we could push further down the throat. What we need to do now is to administer some back blows. So first of all, we need to place the baby down our thigh, making sure that we support the head and the neck. Next, we're going to administer those directly between the shoulder blades using the heel of our hand, up to 5 of them. After each one, making sure that whatever it is hasn't come out. If that hasn't worked, we now need to move on to some chest thrusts. So we're going to turn the baby over, making sure that once again their head and their neck are supported. Using your 2 fingers directly in line with the armpit in the center of the chest, you're going to administer up to 5 chest thrusts. That's pushing inwards and upwards to about 1/3 of the depth. Alternate between the chest thrusts and the back blows. If this doesn't work, repeat this for 3 cycles. Make sure an ambulance is on the way. If the baby goes unconscious at any time, you'll have to do CPR. So remember, if a baby's choking, check the mouth, slap it out, squeeze it out. And that's how we treat a choking baby. If you think an adult or child is choking, ask them, are you choking? Cough it out. If they are coughing, encourage them to continue as they may be able to remove the obstruction. If they're unable to speak or cough, they need your help straight away. If coughing doesn't work, slap it out. Support the upper body with one hand and help them to bend forward. Use the heel of your hand to give up to 5 sharp back blows between their shoulder blades. Then check to see if there's anything in their mouth. If there is, tell them to pick it out. If back blows don't work, try giving up to 5 abdominal thrusts. Squeeze it out. To give the abdominal thrusts, stand behind them. Put your arms around them and link your hands between their tummy button and the bottom of their chest. Clench your lower hand in a fist, grasp your fist with your other hand and pull sharply inwards and upwards. Repeat up to 5 times. Check their mouth. If they're still choking, call 999 or 112 for emergency help. Use a speakerphone if you can. Keep repeating the 5 back blows and 5 abdominal thrusts until the blockage clears or help arrives. If they become unresponsive, open the airway and check their breathing. If they are not breathing normally, start CPR. So remember, if someone's choking, cough it out, slap it out, squeeze it out. If it's not cleared, call 999 or 112 for emergency help. Keep repeating the cycle. Start CPR if they become unresponsive, and that's how we treat choking. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
Okay. So this is just to sum up what is the important part. Again, choking, aspiration, anything can cause choking, blood, secretions, crowns, or anything, any files, any bears. All the list is here. And the patient can swallow. That's why now they are encouraging rubber down. Signs and symptoms, it will be definitely clear. Sorry. Difficulty breathing, cough, splatter breathing, maybe noise and wheeze. The patient will tell frankly that he can't breathe well, and again we'll go back to difficulty in breathing. We will go back to the paradoxical chest movement. The patient using his accessory muscles to breathe, blah blah, all these things. And the signs of blockage or obstructions will be shown gradually: cyanosis, the bluish color of the lip, changing breathing, the awareness of the confusion of the patient, the oxygen will be less, then the patient will get deteriorate gradually. Management: if there is a patient on your chair, and as the scenario said, you put a crown, you put the patient, lean forward a little bit, okay, encourage the patient, ask him to cough vigorously, encourage him, try to have a slap just at the beginning. If you see that the patient is not responding, then we'll go for 5 thrusts, 5 blows. There is nothing called anymore Heimlich maneuver. It is, this name is cancelled. So 5 sharp blows between the scapula, okay? This is here, this is the scapula, 1, 2, and here, and you start slapping, like the lady shows, okay? And again, abdominal thrust. After each movement, slap, you need to check if the foreign bodies comes out. Abdominal thrust. If the patient is not responding, so what else we can do? Common sense. That's it. Call the ambulance. Patient is not responding. Keep monitoring the patients and get ready for CPR. So again, encourage the patient for coughing vigorously, and then not responding. Then you will go for 5 blows, 5 thrust. If the patient not responding, get ready for call the ambulance and get ready for CPR. This is the algorithm for it. Assess. 1 second, sorry. Okay. Assess severity, mild airway obstructions, encourage continue to check for deterioration to ineffective cough or until obstructed relief. So this one, severe, here is what we are worried about, airway obstructions, ineffective, conscious, still the patient is conscious, so we do 5 back blows, 5 abdominal thrust. This is not working, then you will move to the CPR. Cardiopulmonary resuscitation, CPR. The patient is unconscious, no pulse. Okay, you can't hear. The patient is you can't. Sorry, there is no breathing. So this is very important to assess because in 3 minutes, that's it. Everything is almost done, and the damage of the brain will start. So what we check: absence of pulse, pale, no breathing, dilated pupil, and there is no blood pressure. This is the sense. So the patient is almost gone. So at this point, what we do, assess the danger, shout for help, look, listen, feel for 10 seconds, okay? Look to the chest, listen to the breathing, feel if there is any breathing as well. No response, call 999 and start CPR. CPR, what we'll do 30 compressions and then 2 mouth risk, 2 breathe risk breathe. Okay, you continue like that at the rate of 100 to 120 per minutes. The depth of the compression is 5 centimeters. This is the portable suction. This is the D-size oxygen. We almost have this one. This is the main company that supply the dental practices. And here, this is the summary of the basic life support, if you can see it here. Unresponsive and not breathing normally. Okay, call 9 and ask for ambulance. 30 chest compression, 2 rescue breathe, continue CPR 30 per 2. As soon as aid arrives, switch it on and follow instructions. Once you will get the AED defibrillators, you just immediately start. So, sorry. So again, just to revise it quickly, patient is conscious. Okay, assess the danger, make sure there is no, you are not at risk, and even the patient, we don't want you to be a victim as well. Shout for help, look, listen, feel, and sorry, I forgot to tell you, shake the shoulder of the patients. Are you okay? Can you hear me? Can you hear me? Then look, listen, feel for 10 seconds. Then if the patient is not responding, we will start, we call the ambulance, then we will start the 30 CPR 32. Again, unresponsiveness, shout for help, open airway, not breathing normally, 5 risk breathe, no sign of life, chest compression, risk breathe. This is for children. Just 1 second. Now I want to go for this one. This is for the adult, and this is modified being or adjusted for children. So you start, and instead for risk breathe, then you will do 15 by 2. Now, this is if you go to the website, to the resuscitation website, they will tell you that you can do either this or you can do adult algorithm as well. But this is designed for people who think that they are scared to do the adult one because, you know, the patient with CPR, he will end with maybe fractured ribs, and it is quite difficult. So some people are scared to do that on children. So they made a replacement system for them to follow. Again, give 5 initial, this is for children, give 5 initial risk breath before starting chest compression. If you are on do CPR for 1 minute. And the depth is different. As we said there, it is 5 centimeter. For adult, here is for 4 centimeter, or sometimes they said 2/3, and it depends anyway, whatever it will be. Oropharyngeal tube. This is when the patient is lost conscious, when there is pharyngeal edema, laryngeal edema, the patient cannot breathe by its own, then it is the only way is to use oropharyngeal tube. I can remember when I do MaxFax cases, most of them, they are injured people. They be lost conscious, they will not be able to breathe. So this is the first way to try to secure breathing for them. And if we're still not able, then sometimes we'll open her and do tracheostomy for them, and we'll do the tube on from the tracheostomy side. This is how you assess the size from the angle of the mouth to the angle of the jaw. Okay, from the angle of the mouth to the angle of the jaw. This is the pocket mask that I showed to you. See, there is complete peripheral sear here. This is how they hold it. And this is the umbo bag and mask. This should be held by 2 persons. See how he is holding the pocket mask. And this is by manual respiration. Once the patient, or once the oxygen will arrive, this will be removed and will be replaced by oxygen. Practical demonstration for CPR, look for St. John's ambulance videos. This is really nice and very beautiful. We usually do it in the course. It's not, there is no room to do it here. Again, this is the same. Now, Mr. William Hardy is a 60 years old accountant. He reports his present condition is fair. You know that patient has a heart disorder for which he takes any patient. I have 10 patients to check for patient checkup. So every time the patient he come for a checkup, I will update the medical record. Definitely. So I will see in the medical record that he have heart problem, then we need to be extra careful. This is increase the expectation. If I do, for example, extraction for this patient, he have heart problem, so I need to be gentle. I need to reassure the patient. Don't worry, Mr. Adam, I will be gentle for you. Me and my nurse will be here to help you. Okay, if you feel any pain, just raise your hand and stop me. If you need more injection, we can give you more injection. Just reassure the patient. Which he did, diltiazem, atorvastatin, aspirin, daily. He smokes 20 cigarettes a day and has done so far for 35 years. He reports chest pain, particularly during stress or physical exertion. This is definitely the picture. He tells you he has a little tense of thought of coming to the dentist. He don't like to come to the dentist. He is already stressed. As you started the treatment, he has severe central crushing pain, crushing pain in his chest. Left arm, shoulder, he is having breathing difficulty, his skin is pale and clammy, and he has clutching his face to his chest. The problem with angina and myocardial infarction is a name called, now I specifically share this slide because now they call it acute coronary syndrome. Acute coronary syndrome. This is the new name for it. This is a huge number. 2.3 million Look, the crazy number, 70,000 die from coronary heart disease or acute coronary syndrome. Okay, early recognition and treatment is a key management. Okay, angina is a warning sign of a real problem in the heart.
Angina is a symptom of a serious condition called coronary heart disease, also known as coronary artery disease. The heart's job is to pump oxygen-rich blood throughout your body. To do its job, the heart needs a steady supply of blood. The vessels that supply blood to your heart are called coronary arteries. These very important vessels are located on your heart. In a healthy heart, blood flows freely through the coronary arteries, providing the heart with the oxygen it needs to work properly. In coronary heart disease, the vessels become stiff and narrow, making it difficult for oxygen-rich blood to reach your heart. Reduced blood flow that occurs following exercise or emotional stress leads to chest pain or discomfort known as chronic stable angina, which is relieved by rest or nitroglycerin. If a clot develops in the coronary artery, blood flow is reduced more severely. This leads to chest pain known as unstable angina, which usually occurs at rest, and it requires immediate medical attention. In summary, when blood flow is reduced, your heart does not get as much oxygen as it needs, so it cannot pump blood like it should. This lack of oxygen is what causes the pain and discomfort of angina. If you have coronary heart disease, angina is your heart's way of telling you that it needs more oxygen. Talk with your cardiologist if you have questions about angina.
Okay, so just a brief about the angina. Again, it's a warning sign of coming heart problems. So sometimes it is stable. We have two types. We have stable and we have unstable. The stable one. Sorry for that. The stable one will be easy to control. It is, as I said, it's a warning sign. Will make you aware that you might have a problem. You need to go to see the cardiologist. They will do ECG for you. Sometimes they do echo for you. They do troponin enzyme test to check if there is any problem with the heart muscles. It could be controlled by simple management, like sometimes they will put you on a protective aspirin. They will ask you to avoid any heavy exercises or any stress, and the diet is a vital part. The unstable one, where the patient have it and he's just while he's sitting, he don't have any physical activities or any problem. This is a really warning sign and which might need action. So again, severe crushing chest pain, radiated pain to shoulder and arm, skin becomes pale and clammy, shortness of breath, weak pulse and low blood pressure. So this is the main sign, and it's clear for you, even for people who are attending part 2 OSCE, it will be clear for you that there is a chest pain, central chest pain. Management. Whatever you are doing, stop what you are doing. Assess the patient according to airway, breathing, circulation to support exposure approach. It seems to me that you have heart conditions running there or cardiac event are running there. Nurse, please bring me the emergency box. And for all patients, part 2 candidates, make sure to take history. Have you had this problem before? Did you take any medication for it? Did you bring the medication for it? This is very important to be aware about things. Put the patient upright position, I would say more in the most comfortable position, because sometimes the upright is not good for the patient. So put it in the most comfortable position, okay? Give the patient oxygen, or you can give glycerol trinitrate. If you give oxygen first or GTN, there is no problem. Which one is first? Mr. Adam, I'm going to put in the most comfortable position. I'm going to give you this oxygen, put the oxygen mask on the patient. This will give you 15 liters per minute, will help you to breathe. I will give you GTN or glycerol nitrate spray, 400 milligram, I'll give you 2 puffs. This will help you a lot. Keep monitoring, reassess. If the patient not responds, so you need to expect there is myocardial infarction, immediately call the ambulance. Give this person aspirin, 300 milligram, and keep repeating the glycerol nitrate until the ambulance will arrive. We can give glycerol nitrate 2 to 3 times. We can repeat it because we can give it every 10 minutes and be sure that the ambulance will be there around 8 to 10 minutes. So you're not going to repeat a lot. Again, assess the patient according to airway breathing circulation support exposure approach. Put the patient in most comfortable position. Okay, oxygen, GTN. Assess and monitor again. Then if the patient not responding, get ready for myocardial infarction. If the patient showing more extreme signs and symptoms, so it may be turned into infarction. So immediately call 999 and keep monitoring. What is GTN? It is a good idea to know about the glycerol nitrate. It's a potent vasodilator because, especially for candidates part 2, they might ask you about these questions. In any exam, they might ask about, you are a dentist, you need to know the pharmacology of the medication. So the idea is the peripheral blood vessels will be dilated. This will help the blood will be pooling in this area. For example, the peripheral blood vessels here will be dilated. So the blood will be pulled here and stay here, and because there is no power enough to pump it back to the heart, this will decrease the preload or return load to the heart and give chance to the heart. Because the heart is tired, the muscles of the heart is exhausted, because the coronary artery is blocked, so there is no food, no oxygen to the heart, so the heart will get exhausted and tired. So the GTN will give the chance for the heart to take a breath. Take a breath, sorry. Myocardial infarction is a step more. So we saw in the video there is a partial occluded. This could be fully occluded and cause damages and died and ischemic area to the heart muscles or the muscles of the heart. So damage or death to an area of the heart muscles resulting in reduced or blood supply, just like what we saw in the video. Signs and symptoms: sweating. This is very important. Skin, pale, clammy, weakness, fatigue, shortness of breath, severe crushing pain, and anxiety, nausea. Weak pulse, blood pressure may fall. This is almost the same, but the most important is the patient will get more sweating, they might vomiting, he will get more pale, and the pain is disastrous.
Acute coronary syndrome, or ACS, is the leading cause of death globally. The spectrum of ACS ranges from unstable angina to non-ST segment elevation myocardial infarction and ST segment elevation myocardial infarction. Ultimately, ACS is the result of an obstruction of the coronary arteries induced by an atherosclerotic plaque. ACS events are triggered by the plaque rupturing. This exposes subendothelial matrix proteins and other molecules. Platelets are recruited to the site, adhere to the injury, and, together with red blood cells and fibrin, begin to form an arterial platelet-rich clot. This narrows and eventually obstructs the coronary artery. The extent and the location of the blockage and the resulting myocardial damage determine the extent and the severity of the myocardial infarction. Life-threatening arterial clots are formed through two pathways: activation of platelets and generation of thrombin by coagulation factors. Targeting both pathways has been shown to be a viable therapeutic approach.
Again, management, call 99. This is for the myocardial infarction, comfortable position, oxygen, and give the patient JTN and aspirin. Aspirin is given chewable because sometimes the patient cannot swallow well. What just I put in some points so I will not miss them here. Yeah, okay. So always link between the angina and the myocardial infarctions, and it is if the angina, maybe unstable angina, turn into myocardial infarction. Aspirin, it is anti-platelets aggregation, prevent the platelets aggregations by inhibiting the prostaglandin, so it will increase the thinning of the blood and prevent clotting. Your patient, Alan David, is scheduled for a routine examination and prophylaxis. He's 18 years old and has been a patient in the practice since he was 5. There are no significant findings in his medical history, but he admits of being short of breath several times before. You notice he is very apprehensive in the waiting room. We are scary, I think. We are vampires. After you alleviate his initial fears, he accompanies you into the surgery. Once he is seated, you notice his breathing is becoming labored. Wheezing noise can be heard upon expiration. Look how many people they have. Asthma. Look how 1 in 11. So every 11 patients, you might expect one asthmatic patient. Life-threatening, many people, they die from asthma. Asthma, signs and symptoms, very important. So simply, there is quite a few reasons why there is asthma. Asthma is kind of allergy. There is a lot of things for what trigger asthma in our practice or in real life. Allergies, foods, and anything. Here, acrylic, dust, metals, powder, stress, cold, detergent, anything. So what will happen here? The body will respond here, and there is the body tend to react, and thickening of the walls will happen. Mucus production will increase. The gas exchange will be interrupted. The patient will not be able to breathe well. Asthma about it. I lived almost 20 years with asthma. It's horrible. This is all the air around you, but you can't breathe it. It's a really difficult condition. The patient unable to complete sentence in one breath. Respiratory rate more than 25. Heart rate, tachycardia more than 110. So the patient, he is not able to breathe. The respiratory rate will increase. The heart rate will increase, and he barely can breathe, and he barely can talk. So this is important things. So wheezing, coughing, also important, and unable to complete a full sentences. Life-threatening attack. If the patient of the asthma continue to without treatment, so this will be turned into opposite. So what will happen? The patient will, the respiratory rate, instead of increasing, the patient will get exhausted, and the respiratory rate turns into less than 8 per minute. And the respiratory rate, the heart rate will be again move to the opposite side, because the patient starts to tachycardia. He will get tired, then it will turn into a bradycardia to a less than 50 per minute. Patient get confused, exhausted, and tired. There is no oxygen. The level of the consciousness will be definitely affected. Again, this is the beautiful Circle, always remember, coughing, wheezing, chest tightness, shortness of breath. Management, how we will manage? Assess the patient according to airway, breathing, circulation, disability, exposure approach. It seems to me that the patient have asthma. Call, shout for help, put the patient in the upright position, almost comfortable position. Give him oxygen 50 liters per minute. Give him inhaler, salbutamol inhaler. What is the dose? 100 per actuations. Give him 2 actuations. Ask the patient if he can use the inhaler or not. If he can't, give him within the spacer. Okay. A pram, 1, 2. Ask the patient to take deep inhale and inhalation and inspiration. What is the benefit from the spacer? It is amazing. It is giving a good result because the patient will get the maximum from the medication, actually 100%, because the patient will keep breathing on it, so he will keep taking the maximum dose. Also, there is no need for the coordination between the patient, exhale and inhale. No, just put it and let the patient breathe normally with it. Again, a spacer is a device which helps deliver salbutamol from inhaler. Spacers come in adult and pediatric size. One more thing too, if the patient, after giving the 2 puffs, oxygen, keep monitoring, reassure the patient, you will be fine. We'll give you the same medication that you use at home. You will be fine. Everything. Me and my nurses are well trained on how to deal with such cases. The patient is not responding. Then it is the time to call 999. Because the patient should be respond in a few minutes to the inhaler. It's acting in 2 minutes actually. If the patient not respond, call the ambulance, keep monitoring. You can repeat the inhaler up to 10 puffs. Your patient, Mr. Sandeep, is scheduled for routine examination and prophylaxis. He is 65 years old and has been patient in the practice. He is non-diabetic and is on insulin injection. You notice he is very apprehensive in the waiting room. After you elevate his initial fears, Mr. Singh accompanies you in the surgery. Once he is seated, you notice his breathing is becoming labored and the skin is becoming cold, clammy. He is becoming increasingly anxious and agitated. Becoming labored, cold, clammy, becoming increasingly anxious, agitated. The patient is well known diabetic. They should give you this hint to be clear for you, or they will tell you he is, we check the medical history of the patient, he is diabetic.
Diabetes refers to a group of conditions characterized by a high level of blood glucose, commonly referred to as blood sugar. Too much sugar in the blood can cause serious, sometimes life-threatening health problems. There are 2 types of chronic diabetic conditions: type 1 diabetes and type 2 diabetes. Pregnant women may acquire a transient form of the disease called gestational diabetes, which usually resolves after the birth of the baby. Prediabetes is when the blood sugar level is at the borderline, higher than normal, but lower than in diabetics. Prediabetes may or may not progress to diabetes. During food digestion, carbohydrates, or carbs, break down into glucose, which is carried by the bloodstream to various organs of the body. Insulin is a hormone produced by beta cells of the pancreas and is necessary for glucose intake by target cells. In healthy people, beta cells of the pancreas produce insulin. Insulin binds to its receptors on target cells and induce glucose intake.
Sorry for that.
In type 1 diabetes, beta cells of the pancreas are destroyed by the immune system by mistake. The reason why this happens is unclear, but genetic factors are believed to play a major role. Insulin production is reduced. Less insulin binds to its receptor on target cells. Less glucose is taken into the cells. More glucose stays in the blood. Type 1 is characterized by early onset. Symptoms commonly start suddenly and before the age of 20. Type 1 diabetes is normally managed with insulin injection. Type 1 diabetics are therefore insulin dependent. In type 2 diabetes, the pancreas produces enough insulin, but something goes wrong either with receptor binding or insulin signaling inside the target cells. The cells are not responsive to insulin and therefore cannot import glucose. Glucose stays in the blood. In other words, type 2 diabetics are insulin resistant. Here again, genetic factors predispose susceptibility to the disease, but it is believed that lifestyle plays a very important role in type 2. Typically, obesity, inactive lifestyle, and unhealthy diet are associated with higher risk of type 2 diabetes. Type 2 is characterized by adult onset. Symptoms usually appear gradually and start after the age of 30. Type 2 diabetes accounts for about 80 to 90% of all diabetics. Management focuses on weight loss and includes a low-carb diet.
Okay. So this is about hypoglycemia. Okay. Hypoglycemia, I always classify it or subclassify it into 3 types. When the patient is conscious, patient semi-conscious, patient unconscious. Generally speaking, signs, symptoms: shaking, trembling, sweating, headache, difficulty in concentration, slurred speech, aggression, fitting or seizures, unconsciousness. If you remember, if you are fasting, I always tell my students, just remember when you're fasting 2 or 3 years ago, and remember the last hour before the time for breakfast or for eating. You will have all these symptoms: shaking, sweating, headache, aggression. And this is the most important part, aggression. The patient will be really, really aggressive. Okay, so this is very important to know about these signs and symptoms. I like this agreed level of blood glucose, 4 to 7 millimole for fasting and 8 or anything less than 9. This is by NHS website. And for the HbA1c level, this is special test. They make it monthly for the patient with diabetes. And researches and the readings are more depends on this type of test. This has been discussed in the video in details, very nice and beautifully. Okay, management, okay, again, depend on the conscious, semi-conscious, unconscious. For the patient conscious, simply just reassure. Again, I will assess the patient. It seems to me that you have a hypoglycemia. Assess the patient according to airway, breathing, circulation, disabled exposure approach. It seems to me that you have hypoglycemia. Nurse, please bring me the emergency kit. Okay, give the patient Coca-Cola, give the patient chocolate, give the patient any drinks or anything that happen to restore his blood glucose level. Check the blood glucose and see. If the patient turns into semi-conscious, he starts losing his consciousness, getting a bit drowsy. Okay, so we will use this glucogel. We'll take one and we'll squeeze it in the buccal sulcus of the patient mouth. We can repeat it every 10 to 15 minutes, and definitely the blood glucose level will be checked. Now, the patient turns into unconscious, coma, then make sure the patient is safe. Leave the patient as it is. You can give the patient oxygen and then give him a glucagon, 1 milligram in the shoulder or in the thigh. Hold the needle in the pinning grip shape, put it in the perpendicular to the thigh. Okay, it is good idea for patients who are sitting part 2. If you do it, just talk and say, because the research shows that the patient, even if he lost conscious, he is still can hear you. So tell him, Mr. Adam, there is you feel a bit of a scratch. Here we go. We'll give you the medication. 1, 2, 3. Give the patient oxygen and check. Keep monitoring. Check the blood glucose. Glucagon, you can't repeat it because it's not working anymore. Then you need to call the ambulance. The idea from the glucagon is to activate certain enzymes and to activate glycogenolysis. So it will cut and dismantle the glycogen and turn it into glucose and send the glucose to the blood to increase and restore the blood glucose level. So again, assess the patient according to air breathing situation disability, according to the level of consciousness, give the patient management. Unconscious, give him glucagon. Just check the patient. Not responding, then call the ambulance. Again, record everything and make sure you ensure that the patient is aware. Tell the patient if he need any referral to the GP or need contact to the GP as well. Okay. I just quickly wanted to mention about quickly about the hyperglycemia here. Here is different. The patient really looks red, flushed, dry skin, thirst definitely, dry mouth, weight loss. Okay, you can see the patient with high glucose level, they start losing weight. This is the most important sign of diabetic patients. Rapid breathing and the smell of acetone. This is very important as well. Cindy, 15 years old female, comes into the office for her 6 months checkup, accompanied by several of her friends. She is under the treatment of seizure disorder and that she had a tonic-clonic seizure about a month ago. Cindy informs you that her seizure seems to occur more frequent around her menstrual cycle, which she is experiencing presently. Her oral hygiene is poor, and you start to reinforce the brushing instructions when she states she has bad headache, her body is rigid, and she started having convulsion. The patient has epilepsy. The causes is not clear. There is no clear idea why is this happened. However, they are linked to many reasons. The number is increasing. There is many precipitating factors: fear, anxious, not sleeping well, flashing light, and all these things. This is one of the causes, possible causes: previous brain injury, new brain insult, alcohol withdrawal, okay, and non-underlying idiopathic. The patient, there is loads of reasons of the epilepsy. There is with patient with severe jerky movements. Some patient there is silent epilepsy. The patient just stop looking at you, and he will get a silent attack as well. Warning aura. Patient is showing a headache or confusion. He's not feeling well. Then the patient start tonic and colonic tonic phase, where the patient start getting rigid and he start shaking. Jerking movement as well. Sorry, the jerking movement will start. Then this will end with the patient. After this will stop the attack of the epilepsy. It ended. I want to share this one as well with you.
Your brain contains billions of nerve cells, called neurons, that communicate with each other by sending and receiving electrical impulses. A seizure occurs when there is sudden abnormal electrical activity that temporarily interrupts normal brain function. Large groups of neurons fire at the same time, like an electrical storm inside the brain that usually lasts from 30 seconds to 2 minutes. This extra activity can cause changes in behavior, sensation, movements, or awareness. There are 2 types of seizures. Focal, or partial seizures, happen in just one part of the brain, while generalized seizures seem to occur all over the brain. Symptoms usually vary depending on the type of seizure and can include temporary confusion, staring spells, convulsions, or loss of consciousness. If you think you've had a seizure, talk to your doctor right away for more information.
Good. So it is just for electricity, too much signaling, more than the normal range, and cause this problem. Again, stress, flashing lights, dehydration, extreme temperature, yes, 100% change of medication. This is very important with people having epilepsy. and anxiety. Management, very important from your side. Please read the NICE guidelines for management of epilepsy. Very, very important. So always when there is a patient start jerking movement, do not try to touch the patient, do not try to come to near the patient, just make sure everything is safe, remove anything that might injure the patient, ensure that the patient, if he's on the chair, not falling from the chair, and that's it, just wait. Just wait. You can give oxygen mask a little bit far from the patients, and keep monitoring. And the most important thing to manage the epilepsy is the timing. Once the onset started, you need to look at the time and start checking the time. Now, if the patient have epileptic attack more than 5 minutes, then it is the time to give midazolam. Midazolam comes into different concentration according to the age. So simply use this wood stick and mirror just to retract the cheek, and you can squeeze the midazolam in the buccal sulcus. Okay, so assess the patient according airway breathing circulation exposure approach. Ask for help or emergency kit. Remove, ensure safety of you. Check the time. Keep monitoring. Give oxygen. Then give midazolam. Now, if you give midazolam, then that means the patient needs to be referred to the hospital. NICE guidelines said you need to refer to the hospital when prolonged seizure, first episodes, difficult to monitor, difficult to control, when suspected head injury. So any prolonged seizure, repeated seizure, first time, expected head injury, patient alone, old patients, he can't look after himself, so it is better to refer to the hospital. Call the ambulance to refer to the hospital, 999, give your name, address, mobile number, confirm all the details. Again, this is to know the 5 minutes. So you will decide to give midazolam. Midazolam, it's benzodiazepine that we use it in sedation. This is an inhibitor. It's quite risky because it causes respiratory and causes some addiction, but it is inhibit the central nervous system and reduce the electricity and the signals from the central nervous system. Side effects, definitely respiratory depression. As we said, it is benzodiazepine, amnesia, and confusion. You have given an adult patient who needs antibiotic cover of amoxicillin orally and ask him to take a seat in the waiting room. Whilst you are treating your next patient, your receptionist ring through to tell you that the patient you have just sent to waiting room is behaving strangely and appears to be flushed, number one, making wheeze, and his face and lips are becoming swollen. This is the symptoms of anaphylaxis, and we'll discuss it now. So, it is life-threatening, generalized or systemic hyperventilation, sudden onset. This is really, really, really dangerous. The patient might die in a few minutes. Really might die in a few minutes.
Anaphylaxis. Anaphylaxis is a severe life-threatening allergic reaction which could result from exposure to any of the following causative agents: food, an insect bite or sting, drugs, latex rubber, exercise, idiopathic. On exposure, allergen molecules or antigens enter the bloodstream, where they interact with sensitized mast cells, to which IgE antibodies are bound. The allergen binds to the IgE, activating the mast cell, resulting in its degranulation. Mast cells degranulate, resulting in the release of the following inflammatory mediators: histamine, prostaglandins, leukotrienes,
chemokines, platelet activating factor, and heparin. Histamine in particular binds to the H1 receptor sites in the endothelium, activating them, resulting in the following: itching and hives due to the increased vasodilatation, angioedema due to the increased vascular permeability, bronchoconstriction due to the contraction of the smooth muscles of the airway, bradycardia and hypotension due to the increased vasodilatation, epinephrine injected into the muscle is the first line in the treatment of anaphylaxis.
Okay. So this video shows you how the muscle will work, histamine and all things. Now, signs and symptoms. There is a lot of signs and symptoms for anaphylaxis, but there is quite the important things is what we need to correct. We need to correct the edema, the tachycardia or the cardiac problems, and restore the blood pressure. This is the must. Otherwise, if the patient showing that flashing, itching, this is not enough to confirm it is anaphylaxis. It's just a normal allergic. Anaphylaxis reaction, that means there should be systemic involvement. There is a problem with the blood pressure. There is a problem with the heart rate. There is a more systemic problem. Uniphasic and biphasic. Uniphasic, which will be return quickly, and biphasic, which is the most dangerous thing, that the allergens or the reason that cause this problem or this reactions will stay in the body for the next 24 hours. That's why it is important to send the patient to the hospitals for close monitoring. Okay, so again, ABC, airway, breathe, persistent cough, vocal change, difficulty in swallowing, swollen tongue, breathing, noisy breathing, wheezing, asthma. It is just like asthma. The patient have just like signs of asthma. C, conscious circulation, feeling lightness, faint, clammy, confusion, unresponsive, and a drop in blood pressure. This is the most important part. Okay, it triggers in dental surgery. We have a lot. Latex, rubber dams, nickel, local anesthetic, chloroxidine, antibiotics, Alvogen, anti-inflammatory. From my experience, the gloves is very important. Rubber dam is rare, and I have since that time I have only one patient have allergic to local anesthetic, and antibiotic is the main concern. Ibuprofen as well is important as well. Management. Assess the patient according to airway, breathing, circulation, stability approach. Shout for drug box. Put the patient, lie patient flat to restore the blood pressure, or if the patient can't breathe, then put him in most comfortable position, give oxygen, and the first thing you do is call 999. Again, this is the guidelines saying call 999. Some people, they said, why we don't give injection of adrenaline? It's life-saving. I agree. There will be a team of work, but for exam purposes, just put 999 first. This is very important. Then wait for the ambulance to come, give oxygen, reassure the patients. If the patient encounter any wheezing or difficulty breathing, just give him salbutamol. Reassure, record, and write what you need. Incidental logbook, refer to notes to for the ambulance, and if you need to refer to write down your notes to the GP of the patient, you can call the GP and discuss the patient situation. This is what we discussed. Injection, exactly like what we give when we give the glucagon. Adrenaline, this is very, very important to know. What is the action of the adrenaline? They have a triple action, very important. He work on alpha receptor to restore, to reduce the edema, because due to dilated blood vessels and moving the fluids from in and in out. So it is to restore the edema and reduce and correct the blood pressure. This is on alpha receptors. Beta 1, the adrenal work on beta 1 receptors to increase the force contraction. Okay, so always remember it: alpha edema, B bombarding or contracting heart rate to increase to correct the hypovolemia or the hypotension. B bronchial, B beta 2 work on a bronchial smooth muscles to increase the bronchodilation. This is exactly the same action or part from the action of the inhaler of the asthma, to increase the to relax in the smooth muscles and increase the bronchodilation. So triple action of the adrenaline: alpha receptor, alpha edema, B beta bombarding of the heart to increase contraction, B bronchial dilatation. Okay, and here again it's related to our video that you see: stabilizing the mast cells, correct the blood glucose, and increase the supply, oxygen supply. Adrenaline, tachycardia, palpitation, headache, tremor, hypertension, definitely. This is the doses. You need to know these doses just like your name, please. Hyperventilation, patient have quick breathe due to scared, stress from the patient, causes an anxiety and emotional stress, rapid or excessive respiration, and imbalance between O2 and CO2 in blood. Reassure the patient, ask the patient, this is nothing to worry about. Ask the patient to breathe in a clapped hand or in a paper bag. Reassure the patient. If the patient again not responding, definitely call 999. Later. Signs and symptoms: lightheadedness, patient hard dysrhythmia, abdominal cramps, fingers numbness, dizziness. Management: stop whatever you do, reassure the patient, rebreathe, revert to reverse alkalosis using paper bag or hands. Mr. Andrew Walsh, 65 years old, black male who is in your office for his 4-month dental hygiene appointment. He has hypertension and smokes 2 packs of cigarettes per day and has a drink or 2 with dinner to calm his nerves. Mr. informed you that 3 days ago he was not feeling very well and had some vertigo, multiple visions, blurred visions, and some weakness in his arm. The symptoms lasted for about 40 minutes and he didn't call his physicians. So the symptoms started. He begins complaining of an acute headache, important, part 2 candidates, dizziness, loss of vision in one eye, and tingling feeling on his right side. You notice that his speech is slurred and his breathing is labored at rate of 12 minutes. He remains conscious. What emergency Mr. Tafd is suffering? The patient definitely have stroke. We have 3 types of stroke: thrombosis, embolism, and hemorrhagic.
A stroke occurs when there is an interruption in the blood supply to the brain. When a stroke occurs, some brains are temporarily starved of oxygen, causing them to swell and stop working properly. This is why the effects of stroke are worse at the beginning. After a few days, when the swelling starts to go down, some cells recover, but others may not. Even then, other parts of the brain can be encouraged to take over. Ischemic stroke. This happens when a clot blocks an artery that carries blood to the brain. It may be caused by a blood clot, which is formed in the main artery to the brain, a blockage caused by a blood clot, air bubble or fatty lump forms in a blood vessel somewhere in the body and is carried in the bloodstream to the brain. A blockage in the tiny blood vessels in the brain. Hemorrhagic stroke. This happens when there is a rupture of a blood vessel in the brain. It may be caused by a blood vessel which bursts inside the brain, a blood vessel which bursts on the surface of the brain and bleeds into the area between the brain and the skull. It is important to understand that no two people are affected by stroke in the same way. Some people have only mild effects which improve in a short time. Others may suffer more serious and long-term effects. The effect of a stroke on a person depends on which part of the brain has been affected and how much damage has been caused. The brain has two sides, hemispheres. The messages, nerve signals, cross over at the base of the brain.
Okay. So this is stroke, CVA, cerebrovascular accident. This is a lot of people are affecting from this one. It is main concern for people. Now the group age is used to be before 60 and above. Now it's up to go down to 40. So more people are liable now. Okay, the people who are at risk factor to have this condition, people with AF, arterial fibrillation, blood pressure, cholesterol, diabetes, all about lifestyle, smoking, drinking alcohol, all these things. Okay, signs, symptoms, as we said, confusion, headache, nausea, vomiting, patient can't speak, hemiplegia, hemiparalysis, lost speech, lost vision, unconscious, weakness of extremities, loss of hand movement, and facial weakness. So this is, we call it fast, okay? Fast, okay? Face, can't. So you assess the patient according to airway, breathing, circulation, disability, exposure. Approach, shout for help. Mr. Adam, are you okay? Can you smile for me? Can you raise your arms for me? Can you confirm your name for me? Okay? Face, can't smile well. Can't raise arm, can't speak well, can't confirm name. T, it is the time to call ambulance. Call 999, explain what is happening here, reassure, and keep monitoring the patient, give him oxygen, and that's it. Yes. Adrenal insufficiency. Now we are not allowed to give any intravenous. So again, for managing the patient, you assess the patient according to airway, breathing, circulation, disability, shout for help. And in the scenario, definitely it will be clear for you in the medical history that the patient is taking steroids for any reason. If the patient have extraction, fillings, whatever it will be, so the patient will be scared and there could be pain. The patient, he needs steroids to tolerate the patient, glucocorticoids. So the body don't have enough to secrete. So he is not used to this high amount of steroids. So usually they double the dose and increase the dose before any dental procedure, because the body can't secrete the glucocorticoids anymore, so it should be given in form of tablets. So any pain, any problem with the patient, if he is scared, then he will collapse due to deficiency of glucocorticoids. So they might give you a scenario of the patient on prednisolone, the patient on rheumatoid arthritis, the patient have any medical condition that he needs to take steroid. Again, this is clear. The signs and symptoms: collapse, pale, cold, hypotension. Patient might vomit as well. Nothing to do. Airway, breathing, circulation, disabled, exposure approach. Call 999. Lie the patient flat to restore the hypotension, because, as we said, the patient will have hypotension. Give oxygen and wait for the ambulance. That's it. For all medical emergency, essential to document clearly and accurately what happened, who was there, timing, what drugs did you use, when you gave them. Time is very important. When did you call the ambulance? What advice given to the patient? Very important. Brief details. Now, finally, sepsis.
Sepsis, formerly called blood poisoning, is usually triggered by a local infection, such as pneumonia in the lungs, an infected wound, or infection of the urinary tract. Should bacteria from the local infection spread or secrete toxic substances into the bloodstream, the immune system may sometimes go into overdrive, causing inflammation throughout the entire body. You get sepsis. This interferes with the blood flow, which leads to a drop in blood pressure, making it difficult for the blood to carry oxygen to the body's major organs. This can lead to failure of organs such as the lungs, the kidneys, or the heart. In the worst cases, the patient dies in a matter of hours. Detecting sepsis early is crucial, so be attentive to symptoms such as fever and chills, breathing difficulties, diarrhea and vomiting, confusion and slurred speech, low blood pressure and elevated heart rate, low urine production. Sepsis can affect anyone. Help us stop sepsis.
So it is a really dangerous and serious conditions. It is overacting of the body. As we said, people are dying. A lot of people are dying. Look at this. 5 people are killed by sepsis every hour in the UK. So that's why the alarming alerts started now. Okay. This is we discussed. And now, because we are doing triaging at the moment with our system that is not face-to-face, so this are more because the sepsis is sometimes is hidden. The signs and symptoms is not clearly. You're as a dentist. So any dental infection could cause sepsis without knowing. So you need to know, to be aware about the sepsis signs and symptoms in adults and children so you can catch it. So if you think that you need to be worried, so you need to really worry. Now, what you need to check, what you need to worry about, what you need, time, temperature, higher or lower than normal, infection, any dental infection, any dental abscess can cause this problem. Mental decline, confused, sleepy, difficult to rouse. Extremely. The patient, he said, I am too ill, and he said, I am dying and I'm in pain to die. The patient will be in severe pain. All these symptoms and signs, can you believe if the patient have a learning difficulties or they have not able to transmit the symptoms? So how responsibility you have? You need to know and to diagnose. Again, this is in children. Skin abnormality, cold to touch, mottled bluish or very pale skin, rash, seizure, lethargy, or difficult to wake up. So the sign symptom is a bit, different from adult to children. Now, sepsis do not always present with a fever or any obvious. This is the problem. This is the trick. It's not clear. It looks like fever, temperature low, body temperature, chills, shivering, raised heart rate, fast breathing. So it looks like just a flu, misdiagnosed with a flu. So we need to be aware about that. This is very important. You need to know the signs and symptoms. If sepsis is not treated quickly, some severe cases can develop into septic shock. Symptoms of person developing septic shock are feeling dizzy, confusion, diarrhea, slurred speech. So the patient is getting in really serious condition. He needs management. Okay, look at this. About 1/3 of the population that develops sepsis will not survive. 1/3, they will die. Okay, depending on the severity of the sepsis. The remaining 2/3 that do survive can recover completely, over approximately 5% of the survival. Look at what will happen to them. Post-sepsis syndromes, damaged organs, insomnia and fatigue, severe muscle pain, lowered self-esteem, nightmares, hallucination, panic attack. And see, it is horrible because the patient are nearly dead and they are aware of that. This is one of the patient will end. That patient might be die in a minute. Okay, just give me 1 second. Okay, I will be more than happy if you can I shared this link. One second, please. I shared the link for the YouTube channel that I started. I will be more than happy if you can register and subscribe. All the recordings will be there, and you can share it with your friends as well. Could you please, now it is, yes, it is the time for the questions. Could you please repeat at the end phone call to 999? For when you call 999, good morning, my name is Mohammed, one of dentists here. I am working in my dentist practice clinic. Can you, I have a gentleman expected with stroke, angina, whatever it will be. The address is 1 Park Avenue, SK12, 1QI. My phone number is 079 66610. Can you confirm, please? Thank you very much. I wish you can come as soon as possible. Thank you very much. Any question? Feel free. We have 5, maybe 10 minutes. I really appreciate your attending, and you can see the number is full. So that's mean I think I did the job, luckily. Okay. Any question, please? A blood pressure meter is also, yes, it's also mandatory. Yes. Get ready for anything. Get this on. Welcome, Ganesh. Thank you so much. Any questions, any doubts? Please post me, text me. You can read. Well, this webinar will be there for you, so you can revise this. I was meant to put these videos to show you how YouTube is valuable. YouTube is give you a TV book instead of reading, going through books, and no, especially part 1 candidates. This of a great help for you. Please, can you 1 second? Thank you very much, Olga. Before administration, yes, anaphylaxis, call 99, please. Call 99. Very important. Different resources. What resources you mean from where to read? Ibtisam, if you mean from where to read, there is 2 bodies for research guidelines website. This will help you to read about basic life support and resuscitation. Okay. As a dentist, what you need to read from the exam, use research guidelines superseded 2013. If you don't have it, text me. I will send it to you. This is you need. However, any updates, you need to keep eye on BNF, Medical Emergency Chapter 2, help us about it. Okay. Thank you. It's very important. I'm really happy for that. Thank you very much. Tanya, my dear, thank you very much. Swati, welcome, dear. Thank you. Thank you. Suppose shout for help before. Thank you, Doctor. Are we supposed to shout for help before? No. Check, assess, then shout. Hello, Doctor. Can you? Okay, my question is: in case of cardiac arrest, should we use that or start CPR? For exam scenarios purposes, definitely you will do CPR. Start CPR, then you will start with the AD. In real life, no, just to start with the AD. Would you kindly go over the clinical feature of sepsis? Clinical feature. Amr, it is there. We discussed the clinical feature. 1 second, it is here. Everything is here. Oh, 3 pages. Okay, but I use the posters. Is a bit nice and more beautiful. Okay, this is time, temperature. Anyway, this is the most important part. Temperature, infection, mental decline. Okay, this one as well. Okay. Sorry. Feeling dizzy, faint, confusion, diarrhea, slurred speech, vomiting, muscular pain, severe pain actually, breathlessness, loss of conscious, mottled skin. Okay. It was fantastic. Thank you very much, Sudha. Thank you very much, darling. Raya, thank you. Welcome, Raya. Ali, needle stick injury should be covered. This is risk assessment. I don't have time to cover needle stick injury. I wanted to add this to the seminar, but it will be too long and boring. I wanted to cover the excessive amount of local anesthesia or local anesthesia poisoning signs and symptoms and how we manage it, how we do the calculation. But there is no time. Aisha, really thank you. You saved me today, frankly, for services. Fawzia, how would say in the exam management what for services? We will discuss it, Fawzia, later. It could be they will give you a scenario for patient with this signs and symptoms, and you need to manage it. Sadaf, thank you very much. Thank you very much, darling. How long do we have to wait before we do dental procedure under local anesthesia if the patient had cardiac arrest? And how long do we have to wait before we do dental under the patient? For the patient, no matter what you mean, for the same patient, we postponed and all the dental treatment, definitely. How long do we have to wait before we do? And the last, okay. Listen, you do only emergency. 3 months, you do only emergency. 3 to 6, a bit more, but still no routine. Just medical emergency. Just urgent treatment. Just for any patient with heart problem, stent, open heart surgery, just urgent dental treatment. Like pulp extubation, I had 2 or 3 patients in the same situations. There is a nice and beautiful guidelines about it. We can thank you. Up to how many times can we give adrenaline? You can repeat, Mariam, every 5 minutes with managing and controlling and checking the vital signs. So the sepsis is important for them. Yes, it is important. So that for MJDF, definitely. Thank you. Sepsis is added in our area as well. Yes, it is very important. It is very, very important. The NHS, they give us headache about it. Get ready for it, guys. Welcome, Zainab. Welcome, dear. Where to read further regarding sepsis? Just do online. You can do. Okay, I will send you article. So that just remind me. I will send you one BDJ, beautiful one. There is, before I will finish, I have to thank a lot my friend Petquiz. He is running a nice and amazing platform for part 1. He did an amazing job with the people for part 1. I really am amazed for his ambitions, for his dedications, and he helped me a lot regarding videos and all the technical things. Thank you very much, my friend. Really appreciate your help. Nathan, if there is part of dental emergency, yes, you need to get ready for it, Nathan. How long do we have to wait? Okay. Do we need to inform patient GP for? Yes, you have to. You have to definitely inform the GP. Could you please repeat what you said about side effects of general palpitation, heart rates, all these things? Everything, Omar, will be in the on the. I will record it in the YouTube. You can come back. And if the patient on corticosteroids, so do we double? We don't double the dose. Refer to the GP. The GP, he will decide what he is to do. Do we need to ask patient consent in medical emergencies? No. You are following the JDC standards and doing the best interest for the. You're working for the patient best interest. Okay, thank you very much. Welcome, Hadil, Sabtaman, nice to meet you. Thank you, darling. Are you going to upload this video on your? Yes, I will do that. Galaxy adrenaline for severe asthma. It is for adrenaline for severe asthma. Yes, you can give, but it is for highly advanced. It is the last choice and not for all the patient. Thank you, darling. Thank you very much. Okay, thank you very much. Okay, all done. Thank you for attending. Really appreciate that, and wish you all the best. Stay safe and good luck. Anything you need, I'm here. Take care. Bye.